What do you do when you get conflicting advice? Nothing at all. That would be an option. Confront the person who gave you that advice and ask the person more questions. Do you go to other people for extra advice? So basically, do you take action or not? And when do you take action? Well, in my case, I had to deal with this just recently, and I also had to deal with this about 7 years ago. So for those who do not know me, I had an ankle injury. I twisted on a brick like 7 years ago. It resulted in 4 months of waiting before they even did an MRI, then another 5 before they did the first surgery, and then another 3.5 years before they did the second one. And that has had its result, and not positive ones, because I had to learn to re-walk again. I had to relearn to walk again, and basically I'm still doing so. So 4 weeks ago I was really on a high, being able to walk much better without my crutches for a longer period of time. I could actually see progress like weekly. I started boxing again at the physical therapist, so I was really totally ecstatic. So what happened at that same physical therapy during the boxing, she wanted me to do some movements, and I couldn't do those movements. And the reason is that my ligaments aren't very strong. So I twisted my knee this time around. And now I have a partially torn ligament, which I had with my ankle, and there's a crack in one in the meniscus, which is obviously causing pain. Now here's the rub. I had expected him to tell me, you have a partially torn ligament, so we are going to replace this. And he said, no, we are not going to. Because you still have a part which is present. And here's the thing. But what if this is causing the pain? So what he wants to do, and that's actually pretty cool, he wants me to be awake during the surgery so I can actually see the knee. I think that's, just only for that reason I would probably do it. But what I'm not too thrilled about is, first of all, they have to cut away a little piece of the bone because it's not very well being fed with blood. So no blood means no recovery. But yeah, what if something needs to happen with the ligament as well? Do I need a second surgery? Because I'm pretty sure he won't be prepped with, say, a donor ligament, for instance. And I totally do not want him to harvest my own ligament. I just don't want him to do so. So yeah, I'm a little. I'm a little confused. I'm a little uncertain. Then again, he's given me 4 weeks. In 4 weeks, he will call me. And he wants to see what the progress is in 4 weeks. Because if the progress is major, then he doesn't want to do it. So I've just told myself, well, if I can do anything again, which I could 4 weeks ago, then okay, yeah, I might agree. If the pain is gone as well. But if the pain isn't gone, then I will tell him or ask him, okay, why not do that ligament straight away? Because it's such a hassle to go through multiple surgeries. I don't believe it's a good thing for the tissue. But apart from that, I mean, for the knee, it means I cannot drive, and if I cannot drive, I cannot go anywhere, especially right now, because I can't cycle long distances, I can't walk long distances, and basically that means that especially if I were to need more physical therapy, which is the result of a replaced ligament, then I would need to be able to go to the physical therapist at least 3 times a week. Well, in this case, the whole thing was different. So he wants me to stay away from the physical therapy for at least 3 weeks. Also, the surgery won't take place till the beginning of August. I would have preferred it to be sooner. He still believes that it could improve, and you know, it literally takes me back to 7 years ago with the other doctors. And so yes, he knows something is wrong, and he does believe me. So that's the good thing. But the not so good thing is, because I know what to do in order to get rest and improve myself, that because I say I have less pain, they are not inclined to do anything anymore. But why do I have less pain? Because I literally do less and I take more rest. And my goal is to get back to where I left off 4 weeks ago. You know, get on with the boxing, get strength back in my left leg, because he says there's a big difference between your left and your right leg. Yeah, I basically have been standing on one leg for 7 years now. I mean, what do you do if you have no stability? You find stability on that one leg, and that's what I've done. What do you do if you want to avoid pain? You stand on your right leg, which is what I've done. So this is really, you know, conflicting advice from him. But like I said, he's giving me the opportunity to talk to him about it, so that's good. So I guess I'll just go see if I can get back to walking like I did before, and see how much it hurts. Well, the not so neat thing is that in order to be able to go back, I need to rest first. Or I need to take my crutches with me, and I just don't feel like taking the crutches with me, because I know that gives a, you know, there's a big difference with using the crutches and not using the crutches. The stability is completely different. There's far less the amount of weight I'll put on my leg is less, so it doesn't require as much effort compared to walking without crutches. And you know, there's also this sense of freedom, and I want my freedom back. I want to continue with that freedom. And yeah, that's I guess that's what's making it difficult. So my advice would be, check it out, write everything down. Well, I'm writing everything down, talk to other people, which I still will be doing, and maybe I'll even ask for a second opinion before August 6th, because I think he's being too careful, and I do not understand why exactly. So that would be the third thing. Ask him why. Why is this his motivation? Why is it something he wants to do? And I believe that he thinks actually that the pain is being caused by the crack in the bone, in the meniscus, and not by the ligament. And I know that the pain is being caused by the ligament as well. And whenever I say, when I actually feel it, he knows that it's true, that this is caused by the ligament and not by the meniscus. So, well, the physical therapist, too, husband and wife, are involved too. So I'll just have them talk to him as well. And, you know, there's no reason to rush. I just want to avoid 2 surgeries. And I guess that's the last thing. What is it you want? And what's your heart limit? So what's acceptable to you? Well, not being able to drive for me for 2 times in a year, that's not acceptable to me. You know, there's a lot that has to be arranged, like either being able to get a cab here, which is paid for by the municipality, the local government, or stay at a care facility. And well, of course, that has its benefits, I have to admit. But I'm a person who loves freedom, and I guess if I don't need the surgery, that would be best. But I just see that film, that movie from the last 7 years, and I know that's not going to be the outcome. I already know it. I knew it back then, and I know it right now. And I guess that's something I am going to need to explain to that surgeon. But no rush. Like I said, in 4 weeks he's going to call me again. And I guess this is also about agreements. So when it comes to the conflicting advice, will they give you the option to discuss it again? And when will they give you that option? So it's up to me to relax again. It's a little confusing because the first time around, last time, he already started talking about surgery, and I was like, what, hey, that. And of course now she's talking about surgery as well, and then it's a different one than expected. And I could use a certain word, let's call it mind bleep. Because it does screw with my mind, I'll tell you, and basically that does cost me energy, because I have to be able to understand it, wrap around my head around it, and just see what happens. Anyway, you heard my advice. Always go back to the person, talk to him about it, talk to other persons about it, make up your own mind. What are your hard limits? What do you need? What do you need to get out of it? And I will keep you posted.